Okay, so we'd start from here. We see the branches coming off of the arch of the aorta. So this first branch that's coming off is going to be the brachiocephalic trunk. This gives off the right subclavian, which we see here, here, and here, and it gives off this branch right here, which is going to be the right common carotid. The right common carotid is going to give off two vessels. It's going to give off this vessel and this vessel here in red. This is going to be the right external carotid, and how do I know that? It's because of this vessel right here, which comes off of it. And you know that that has to be superficial. It's not going to the brain, so it must be the external carotid. Therefore, this one must be, by process of elimination, the internal carotid. On the left side, we see that this is coming off directly off of the aorta. It's the second branch, so that's the brachiocephalic. And this in here and this right here is going to be the left subclavian. If we follow down, this is the thoracic aorta, because again, we're above the diaphragm. Okay, here's the diaphragm here. So thoracic aorta. As we move down, we notice right here, this would actually be the branches of the celiac trunk. Now, I'm not going to test it on this particular model, just I don't like the orientation of it on this model. That's not giving a clear representation. So just understand that these are the branches of the celiac trunk. This right here is the abdominal aorta. So this right here, all this here is the abdominal aorta. We see this branch, which is coming out just above the left renal vein. So this is the superior mesenteric artery. Down here we have the inferior mesenteric artery. These two vessels that come down off of the aorta, right down here, notice that it's moving down toward the inguinal area. These are called the gonadals. Now, if we don't know the sex of the individual, we just say that these are gonadal arteries. If we know that this is a male, we're going to call them testicular arteries. If we know it's a female, we're going to call them ovarian arteries. If I follow the aorta down, it gives off this branch right here, and this is going to be known as the right common iliac. The right common iliac is going to bifurcate into this and this artery. This artery right here is the external iliac of the right side. This is the right internal iliac on the inside. So right internal iliac, right external iliac, and right common iliac. If we look up, we have this artery right here, which is going to be called the right renal artery. If we look on the opposite side, this is the left renal artery. This again is the left renal vein. This is the left suprarenal or adrenal vein. So again, left renal vein, left suprarenal vein. Notice that the left gonadal vein goes directly into the left renal vein, whereas the right gonadal vein goes into the inferior vena cava, which is this one. So here's the inferior vena cava. The veins are going to match up with the arteries, so I'm not going to do those. This right here, notice that this vessel right here is going deep within the leg. And how do I know it's deep? Because if I look at the side, here's the fat. So the skin's out here, fat's here, and then the muscle must be underneath it. Let's roll this plastic here. So this is going deep, so this is going to be the femoral artery. Remember, once we pass the inguinal ligament, the external iliac becomes the femoral artery. This is going to be the femoral vein, but being that this is superficial, is going to be the great saphenous vein. Now, normally the great saphenous vein follows the direction of the sartorius muscle. So again, great saphenous vein, this is the femoral vein, femoral artery. And that's all.